I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. This is the fourth video on congenital infections in newborn. Today, I'm going to talk about herpes simplex virus and HIV or human immunodeficiency virus. Herpes simplex virus, there are two types of herpes simplex virus, 1 and 2. One infects the oral cavity and areas around the mouth, while herpes simplex 2 virus infect the genital area or genitals. It has been suggested that latent herpes simplex virus 2 infection occurs in as many as 20 to 40% of women. Exposure of fetus to herpes simplex virus at the time of delivery carries a serious risk of infection for the newborn. This risk may be high during the initial infection of the mother, 30 to 50%, but probably does not exceed 3% in cases of the reinfection because of the protective effect of maternal antibodies. If baby gets infected, if fetus gets infected during the pregnancy, then the head size is usually small. Some parts in the brain are not developed or missing. Eyes are small, including the skin lesions. So what are the common signs and symptoms or features if fetus is infected during the pregnancy? So intrauterine growth retardation, premature birth, or head size is small. And if baby gets infected with herpes simplex virus at the time of the delivery, so what are the common signs and symptoms? The symptoms of congenital herpes simplex start within the first day of life, but can be delayed up to 1 week. Congenital herpes simplex infection can be localized, limited to eye and mouth disease. Sometimes baby suffers with encephalitis, which is infection of the brain, and some suffer with disseminated herpes simplex virus infection. Encephalitis usually occurs between day 8 and 12 days of life. Severe disseminated infection can cause irritability, fits, difficulty in breathing, jaundice, bleeding abnormalities, shock. The clinical picture of disseminated herpes simplex virus infection can be challenging because it is difficult to distinguish between disseminated congenital herpes virus infection and bacterial sepsis. While localized skin disease seems to be benign, treatment should still be initiated as early as possible to prevent progression into more severe disease with central nervous system involvement. So in disseminated herpes simplex virus infection, severe encephalitis, chorioretinitis, that is eye involvement or infection in the eye due to herpes simplex virus, skin lesions, hepatitis, bleeding abnormalities, pneumonitis or infection in the lungs. So how it is diagnosed? Viral culture and a detection of viral DNA by polymerase chain reaction are gold standards. So these tests are done on blood, and if central nervous system is involved, then CSF or cerebrospinal fluid, eye, mouth, rectal swabs for viral culture and for viral PCR. After detection of viral DNA, treatment is started. That is acyclovir, which is an antiviral drug, 20 milligram per kilogram 3 times a day for 2 to 3 weeks to infants. And if mother gets infected during the pregnancy, she also receives antiviral treatment. Neonates with congenital herpes simplex virus should be placed into the neonatal intensive care unit for proper management and care. Primary or recurrent active genital herpes in a pregnant woman at time of labor is an indication for cesarean delivery. Human immunodeficiency virus. Infected mothers are able to spread this virus through the transplacental route to the developing fetus. Pregnant women who are confirmed to have HIV or human immunodeficiency virus can transmit the virus to their fetus in up to 40% of the cases. In almost all newborn of HIV positive mothers, HIV specific antibodies are present at the time of the birth. It does not mean that baby is infected. So serologic reversion has been reported to occur in a considerable number of children by the age of 18 months. Breastfeeding has also been linked to an increased risk of postnatal transmission of HIV to infant. The early signs and symptoms of congenital HIV are liver and spleen are enlarged, yeast infection or candida infection, especially in the mouth, or other bacterial infections. Repeated lung infections are very common and child usually fail to thrive. So how congenital HIV is diagnosed? The diagnosis of congenital HIV infection can be confirmed by a positive polymerase chain reaction test. A negative polymerase chain reaction test at birth, at 1 month and 4 months of life is sufficient to exclude the congenital HIV infection. One antiretroviral drug, zidovudine, is given to the mother prenatally during the delivery, and administration of this antiviral to newborn, it definitely reduces the risk of vertical transmission of HIV to the infant. How mothers who are positive for HIV and newborn, how they are managed? So heart therapy or antiretroviral therapy to confirmed infected infants. Zidovudine during delivery for mothers C-section. If mother viral load is more than 1000 copies per mil, exposed infants gets zidovudine orally for 6 weeks after birth. Trimethoprim sulfamethoxazole prophylaxis until HIV status is known to prevent the bacterial infections. Thank you very much for watching this video. If you have any question, please write down in the comments. I will answer. Thank you.